presentation will provide a brief overview of the role of the Outcomes Champion, which we see as vital in optimising the implementation of outcome measures within routine palliative care practice. The following slides will outline the key responsibilities of the role. The Outcomes Champion will be a team member who understands how outcome measures can be used to collect, score, and report the clinical assessment of symptoms in palliative care, and who supports their colleagues in service to effectively implement the routine use of outcomes measures. The role involves providing training and leadership to facilitate colleagues' understanding of the purpose and benefits of using outcome measures, to support the integration of outcome measures into routine palliative care clinical assessments, to encourage the use of outcomes data to inform clinical decision-making and discussion amongst the whole MDT, and to cultivate consistency in the use of outcome measures between members of your team, and to improve the processes used by your service to capture and interpret outcome measures. This will be achieved through a combination of providing one-to-one training to your colleagues, facilitating collaboration between members of your team, and working closely with your service managers to identify improvements to supporting the adoption of outcome measures. The role in supporting individuals means working one-to-one with colleagues to help them understand the purpose and benefits of using outcome measures in palliative care and offering ongoing support to staff as they learn to integrate the use of outcome measures into their routine clinical assessment. This will involve helping staff to become familiar with the phase of illness, Australia Modified Karnofsky Performance Scale, and integrated palliative care outcome scale tools, including explaining specific phrasing and definitions, signposting Resolve and other relevant training resources to help develop understanding, facilitating reflexive discussion about adopting outcome measures in clinical practice, and providing ongoing mentorship to staff. The role also encompasses helping to ensure the quality of application of outcome measures within your team. This means meeting with your colleagues and discussing patients using outcome measures and sharing experiences of using the tools and outcomes data in broader clinical practice. This can be achieved by facilitating group meetings to highlight individual approaches and to recognise the subjectivity involved in using outcome measures, developing consensus understanding to improve consistency in the application of outcome measures between individuals, encouraging the use of outcomes data during discussions with all members of the multidisciplinary team, including medical staff, allied health and social care professionals. It can be used to identify training needs within the team and can be an opportunity to provide or source relevant additional training. This might, for example, be through a teaching session about a specific measure or definition. Finally, the role of the champion extends to helping to expand the impact of outcome measures within your service. The champion plays a key role in empowering patients by supporting staff to use the online training resources to enhance how they communicate and interact with patients and their families, with the aim of identifying needs and improving patients' experiences. The champion is also an essential conduit between individual team members and the service leadership team, Facilitating ongoing feedback about staff experiences with outcome measures will help inform the development of resources used by your team. This might, for example, include modifying IT documentation templates to improve the adoption of outcome measures. In turn, feeding back to your team about what outcomes data can tell you about the acuity in your service and the type of impact you are having to support symptom management for patients receiving palliative care. Change is not easy, and this is a major change, but it is intended to enhance our assessment, demonstrate how palliative care works, and overall to help improve care for our patients.